Hello, this is Angela Brown, and I am completing the Unit 4 journal assignment for MN662. So, first, I want to briefly discuss a client encounter I had this week and note the modality used and what the diagnosis was. So, we had a patient come in today, not today, but this week, in which she had issues because as a child she was molested and raped by her mom's boyfriend. So she had fears that someone would molest her child. She had a 5-year-old boy, and she has a daily fear. She's stated that every day she checks her child's private areas to make sure that no one has did anything appropriate to her child. She said she doesn't trust anyone. It was very hard for her to find an early childhood center for her child because she just couldn't bear the thought of her child going to a school and she would not be there. She also explained that she does not trust anyone to keep her child, family members included. So she's with her child all the time, and as a result, she has no free time and no time, for anything other than her child. So she was diagnosed with generalized anxiety disorder. And the question also asks us what modality was used, and the modality that was used was the CPT, which is the cognitive behavioral therapy. This therapy basically tries to change the negative thoughts that the individual have. It is thought that the negative thoughts that the person have reflects basically how they behave in their lives. The thoughts affect their behavior, and their behavior affects their lives. So the goal is to change the unhealthy thoughts to positive, healthier thoughts. And so the next question is: consider a psychotherapy session with an adolescent or pediatric client for a similar reason. What special considerations are most important for this age group and population? Well, because it's a child, and children are treated differently than an adult population. With the child, you want to use the brain-based approach, where that simply means that it's not the same where the child have negative thoughts, and that's the reason where they have negative behavior, and their lives are disrupted. First of all, their brain is not completely developed, so you have to look at it as you have to move away from the goal behavior management approach and use a neurobehavior approach. So really, no matter how bad or the level of intensity with the child behavior, you want to treat it differently. First of all, you want to use an individual plan for the child. You want to use an individual plan for the child, and you just basically want to look at the child's behaviors as symptoms of brain differences. So you basically must look at the function of the brain and nervous system as the primary focus for interventions. do I see, the third question is, do I see myself working with this age group and population in the future, in future clinical practice? I do. I have no problems working with any population. I would first, you know, learn as much as I can to properly treat the patient, properly and effectively treat the patient. Thank you for watching, and